We're getting more and more data around the importance of nutrition, in particular amino acids, which are basically organic compounds, sort of the building blocks of proteins. The essential amino acids are amino acids that you cannot synthesize yourself and require basically your diet to consume those to then build on those. So when we're thinking about recovery from surgery, just like recovery from working out or any other trauma, it's important to have the right supplementation. So I want to dig just a little deeper into specifically amino acids today, because there's been some studies that have come out around joint replacement showing that if you consume amino acids before and after surgery, we can see faster recovery of the muscles and improved function. So before we get into this, I just want to throw out a couple of caveats. One is that there are always risks associated with taking any supplements. Some of these supplements may not be regulated by the FDA, and so it's important to consult with your primary care physician or your prescribing physician if you're taking other medications. I'll also just throw out there, I'm not a medical doctor who specializes in this. I'm not a nutritionist. But the other thing to be aware of is if you're pregnant or breastfeeding. Again, talk to your physician. Let's look at, regardless of that, what you can do around surgery and what that means for you. A recent paper that came out in the European Journal of Orthopedic Surgery and Traumatology. This came out in 2024, and this was looking at basically randomized trials that have come out, specifically looking at amino acid supplementation and total knee arthroplasty. And it was a systemic review. There were 4 papers that were ultimately included with just about 150 participants. And they looked at supplementation ranging from anywhere from about 2 weeks to 1 month. And the dosing changed within the papers, but it was basically up to 1 to 3 times per day. What it showed was increased muscle mass. It showed decreased atrophy and overall improvement in function. So when we dig into this study a little more and we look at the 4 papers that were included, the one that I think is most pertinent to what we're talking about was with specific amino acid supplementation. And they did 3 grams of essential amino acid supplementation. Now, this was taken actually 3 times a day after a meal, and it started 1 week before surgery and then extended for 2 weeks after surgery. And the kind of things that we can measure here, which we don't candidly routinely measure after joint replacement, are things like your femoral muscle area. So that's the femur muscle. And what they did there is they actually measured it with an ultrasound. They also looked at specific markers like serum albumin, which is a protein marker in the blood. They also looked at some functional metrics like knee pain, but also mobility. Let's look specifically at that study. So this one is a double-blinded randomized study. This came out in the Journal of Bone and Joint Surgery, and this was back in 2023. The other thing I like about this is they measured all of these metrics before surgery, after surgery, and then periodically for up to 2 years. So it gives you an idea of not just where you were before and then where you are after, but also, we think about these things. And if you stop taking this supplementation, how does it affect you over time? And what's the long-term outcome, which is, I think, what a lot of us value. There are just a few things that are worth noting here. When they looked at what were the predictors of size of the muscle and strength of the muscle up to 2 years after surgery, there were actually 3 things they found. And this is pretty consistent with other papers that have been published. The first is the supplementation. The second is male gender as opposed to female gender. And the third is age, being that younger patients have faster recovery and greater strength than older patients. Part of this makes sense because when you do the supplementation, you're basically combating the effects of trauma and surgery on the body, which can cause increased breakdown if you don't have the appropriate nutrition. The same journal, JBJS, had another paper in 2018. This was a smaller sample, about 40 patients. Half of them took essential amino acid supplementation, half of them didn't. And they looked at a lot of the same parameters in terms of muscle volume and then in terms of nutrition and function. The big difference here is they used an MRI instead of ultrasound, and they looked at the quadriceps, and they also looked at the hamstrings. And what they found is that the patients who did supplementation had decreased atrophy of those muscles, and that was statistically significant compared to the patients who didn't take the supplementation. But this supplementation protocol was different. This time it was 2 weeks before surgery, and then they actually took it for 6 weeks post-operatively. You're seeing, even amongst all of the ones that we're looking at here, they're not apples to apples, and you have to kind of take all of these individually. But I think the findings are similar. The other interesting thing here is they did not find a difference in the laboratory values or overall function between the 2 groups. Yes, it was consistent in showing that we maintained muscle volume relative to the other patients who didn't take supplementation, but we weren't seeing the same effects in strength, function, and overall lab values. And just to be clear on this protocol, this was 20 grams of essential amino acids taken twice a day for a total of 40 grams. So again, different supplement, different timing in terms of preoperative and postoperative, and also different dosing. So twice a day as opposed to the other study we looked at, which was 3 times a day. Because it was so varied and because even though the results are compelling and the journals are quality journals, peer-reviewed journals, the protocols are different. The doses, the timing, how much before, how much after, those are different. Hopefully, as more information comes out, we can get a little bit more granular in terms of what makes the most sense, what's the minimum amount you should take and the minimum time period before and after surgery. But at the end of the day, what I think is the take-home point from all of this is that everybody can benefit to a certain extent from supplementation, especially if you're not getting it in your regular diet and not actively eating the types of foods that could provide you that on its own. Now, I'm not an advocate for any particular brands. I don't have any industry ties here. I have nothing to gain. But the more you read these papers as they're coming out, the more compelling it is, and the more you can't help but wonder how much we could be benefiting our patients by prescribing some of these things, or at least suggesting them and having them work with their primary care doctor or nutritionist to get what's right for them.